Welcome back to another episode of Surviving Out of Spite. As you can see, Samantha is not with us today, but I am your host, Levi Peterson, and introducing the lovely, the talented.
Hi, I'm Victoria Killian. I'm a volunteer with G-PACT and just recently was accepted to be on the board of directors. I kind of pushed for the start of the gastroparesis support group because I felt like there was a deficit in the need for patients to have peer support. So that's just a little bit about me. I'm also a board certified patient advocate and volunteer for a ton of different organizations and have a ton of different illnesses besides just gastroparesis.
And today we have quite the episode, talking about the spiteful side of healthcare, navigating insurance and access to care, which I'm somewhat of a new patient here, since you've heard a little bit of my story, you know a little bit of what I've been dealing with, so I'm still kind of broaching into this world in a much newer way. So I'm still learning about all the treatment options and all the fun things that I get to look forward to. So what are some of the challenges that you have overcome as a patient dealing with gastroparesis? What are some of the curveballs that you've been through?
I think one of the largest curveballs was the fact that I wasn't diagnosed for about 15, 20 years after I first started having symptoms of gastroparesis. I started having symptoms at age 12 and saw a pediatric gastroenterologist who did a lot of testing, but basically just told me that I had IBS with stomach involvement, which is literally not a thing. And so for years, I was just kind of dealing with it myself until I got married and got out of the health plan network that I was in and started to find some new physicians. And at that point, I was doing okay. And then I started having a lot of stress at my job, and that knocked off my gastroparesis to be extreme, to the point where I finally, at that point, had a physician who was like, that's not normal for you to feel constantly full, for you to feel constantly nauseated. And so she referred me to the top guy at UCLA, who very quickly, just through my symptoms alone, was able to finally tell me, I think you have gastroparesis, but you haven't had any of the tests, so we need to do all of the tests. So I had an upper endoscopy, a colonoscopy, stool test, and of course the test that everybody eventually has to get diagnosed, the gastric emptying scan. And that showed very quickly, right away, that I no doubt had gastroparesis. But since being diagnosed, one of the most difficult things is the fact that you are constantly educating all of your providers as to what gastroparesis is, how it significantly affects you, what flavor of gastroparesis yours is. Having the task as a patient when you're feeling sick, when you're malnourished because you haven't been able to eat, to then have to keep walking into physicians' offices and educate them as to what gastroparesis is and how it systemically affects you. It became a lot. I think the other difficulty is the fact that it seems as if a lot of these specialty professions like gastroenterology, a lot of those physicians are starting to very much so like hone in on one thing. Like, I am the physician that is going to work with patients that mostly has inflammatory bowel disease and ulcerative colitis. I am the physician that's going to work with people with liver issues. And so because of that, even though they're general gastroenterologists, they tend to like forget about all of the stuff that they were taught, which is really difficult as a patient, especially with something like gastroparesis. That's one of the most frustrating things.
It's not fair to put that on the patient every single time and know that as soon as you say the G word, they're going to bring out the other G word, Google.
Which is also problematic because most of the time in the different gastroenterologists that I saw, the first thing is, okay, let's try Regland. I tried Regland once. I had a really bad reaction to Regland, unfortunately. And so every physician I was seeing, it was Regland. And then here is a piece of paper that has this diet that you should follow. And it's not tailored to the individual patient. And it seems as if they don't understand how significantly gastroparesis impacts patients, is life altering. And it seems as if it wouldn't be, but it really is. When you're feeling horrible, when you're having to hide in the bathroom because you're vomiting because you don't want your family to know, or you simply can't make that, Thanksgiving Day because you feel terrible and you can't be around food and you can't smell food. It's really awful for patients. So that, on top of the fact that the medical professionals, unless you see people that really understand gastroparesis, that are motility specialists, having to constantly like validate yourself, your symptoms, your feelings, how it significantly impacts your life is just so incredibly tiring as a patient.
And I think that's been probably one of the most taxing things to have to deal with going at this a second time. Because I still remember, I mean, even when we were talking like in the beginning episodes of this podcast, both Sam and I have talked about dealing with Reglan, dealing with all of these different things that doctors treat like a one size fits all option that very much we know it doesn't work out that way. We know how we end up feeling after the fact. I mean, I ended up in the hospital. I mean, you had your own reaction. We've all been through our own things. I feel like a lot of times when doctors don't have an understanding, that's really where the options go to die. And I feel like that's where a lot of my anxiety comes from, as kind of feeling like a new patient all over again, because even though I already have a little bit of a semblance of what doesn't work for me, I'm still like, I am just at the tip of the iceberg of just understanding this condition fully. Because even with what you were saying as far as how much this alters your life, all of a sudden it was like my life hit a pause button. And no matter what I do, no matter how many times I try to press play, I just can't get it to happen. So it's like, how am I able to do any of the things that I want to do and also be well enough to be able to be transported to have a colonoscopy, to get treated? You need to be able to be okay to go out and get treatment half of the time, but I can't even get there.
I'm totally with you there. I remember when I was at my worst, I was a really low weight. I mean, very, very low weight for me. And I remember going to the top surgeon here in Los Angeles that does the gastric neurostimulator implantation. This was, I mean, years ago. This was well over a decade ago. And I also am not really a candidate for a J-tube because I have a connective tissue disorder that is not diagnosed and they don't know what it is. And it just will cause a whole bunch of problems in general. And so I went to him and he spent a half hour with me. He looked over everything, took my history, and then basically just told me that I wasn't a candidate for the gastric neurostimulator, not just because of the symptoms that I was having. He didn't think that it would really help with the type of symptoms that I was having at the time, but also the fact that I was underweight and that he needed me to get larger in order for me to do the surgery for the thing that I needed in order to get larger. So you're telling me that I need to be healthier enough in order to get the surgery, but I can't get healthy unless you give me the surgery. And it's that roundabout. And then since getting long COVID, which I have now, which knocked off my gastroparesis really bad last year, I can't make it to a lot of physician's appointments because I feel horrible. I mean, it is that perpetual state that I think a lot of us are in with gastroparesis, where you feel like you're going to vomit, but you're not going to vomit. You don't know if you're going to vomit or if you're going to poop or what. And you're in that perpetual state, even though you may have only eaten a couple of crackers. And I can't focus enough to get myself in the car, drive myself to a physician that's a half hour away, sit in their office for the, hour that they're going to run behind, because that's what always happens, have the discussion with the physician, and then come home. And it has very much so limited a lot of options for potential treatments because I cannot see physicians in person right now. So I totally understand where you currently are sitting, Levi. It is awful.
I mean, and how do you even begin to advocate for yourself when you feel this tired, when you're this drained physically and emotionally, mentally, like all of that? Like, how do you like to deal with that?
I like to block it.
Same.
There are certain times of day that you can tell when you're a little bit better. Like in the morning, if I start real early and it's before I've eaten, because once I eat, I get bogged down for a while. If I haven't eaten, then I can make a couple of phone calls in the morning. But of course, when is everybody making the phone calls to all the physicians' offices and the insurance companies? In the morning. So there's a second time period for me towards the afternoon where I will then sit down again and try making phone calls. I don't know. I try to push myself, I guess, because I've been doing this my entire life. I don't know a life any different than having to advocate for myself, which is why it's really hard for me to make recommendations for patients because everybody's in a completely different situation. It not only does it depend on, where you are within your journey of your digestive tract paralysis or gastroparesis diagnosis or any sort of chronic illness diagnosis, and where your energy levels are and where your concentration is and that sort of stuff, but it also depends on, do you have access to internet more easily? Do you have access to be able to step away from work in the middle of the day and sit on the phone for an hour, trying to call physicians? Some people don't. They work retail. They can't do that. I feel for people like my husband. I'm constantly doing medical stuff for my husband because he works all day and he's in 20,000 meetings and he can't sit on the phone for an hour. So if you can lean on people around you, whether or not it's family members, whether or not it's friends, really reaching out to your community of people that you trust. That's the secondary component. It needs to be people that are not going to be like, oh, well, you should do XYZ and blah, blah, blah. No, they just need to take on the task and not say anything about it. They just need to help you. If they start, being peanut gallery and saying a whole bunch of things, then maybe they're not the right person to lean on. But there are ways where they can help you with your medical stuff. There are forms that you can sign that allow them to talk, to make appointments for you, to talk to your insurance company, to talk to your physician if need be. And I highly recommend doing that. For people that may not have a very large community, maybe it's just themselves, which happens a lot. If you're in a medical system like a large hospital medical system or a larger medical system, contact their patient department, their patient experience department, and see if they have any social workers that you can maybe talk to, because they may be able to hook you up with local nonprofit organizations or with other different types of communities that you can become a part of so that you can then gain access to maybe assistance and help from other people that doesn't cost you a lot. Another option of hiring a professional patient advocate, but that is not feasible for everybody. It is definitely money that you have to pay yourself. Your insurance does not pay for that, but that can also be helpful.
Aren't there a few organizations also that provide those types of services for free, I want to say?
There are a few organizations, but it can be really difficult because they can be very choosy.
Yeah, the wait lists.
Correct. There's a lot of wait list. And if you have gastroparesis and you aren't eating and you're vomiting, you're not getting nutrients. And so you can't wait. It is an emergency, because if you are losing protein, or for me, vitamin C is like the one thing that I have the most difficulty getting. That waiting period can be difficult. So while there are a couple different organizations, I think the Patient Advocate Foundation is one of them. I know there's a couple others that might be coming up. I know there's a lot of people that are working on AI tools that could potentially help you with this sort of stuff. That is definitely an option. But again, if you don't really have access to high-speed internet, it can be difficult to gain access to a lot of these services. So that's why community, come to the gastroparesis support group, come to the 2B support group, ask questions there. There's also a really fantastic Facebook group called Harnessing Healthcare, which if you have questions in relation to healthcare coverage or, why am I being billed this crazy amount? That's another fantastic group. There's a couple different advocate-based things where you can ask questions on Reddit. Reddit is full of information in many different ways. That's another resource that you can kind of turn to. But in terms of if you are exhausted and you need to advocate for yourself, you really got to lean on people that are around you, even if it's just one person. And you have to be vulnerable enough and open yourself up enough to people that you trust. Again, not people that are going to manipulate you or try to interject themselves in your life, which can be difficult. But sometimes we have to be vulnerable. And I know that that's really difficult for people like us that are constantly trying to hold our lives together and make it seem like we're not sick.
If I'm being honest, I think that's been probably the hardest part of this journey for me, is knowing when to admit that I need help. It's knowing when to admit, okay, I'm in too deep. I said I was going to call this doctor a couple days ago. It's officially been 2 weeks. When am I actually going to do this? When am I going to have time and feel okay enough? Because it's almost like you become so burnt out that you mentally cannot handle or fathom using your phone that way right then and there. You just can't. Because you know it's going to lead to another test. which is going to be more bad news. And you just don't want to mentally deal with it. And I think for me, the administrative burden and the executive burnout that I feel when I'm dealing with all of this, being the professional patient, when you're that all the time and you are 24/7, always on, there is a breaking point. And I know for me, getting re-diagnosed, I think is when I started to hit mine and I had to admit like, okay, like I need to slow down, like I really need to start like taking care of myself and taking time because now we've got three rare conditions that I'm dealing with in my arsenal on top of everything else that I'm already dealing with. And now it's like I'm in this place where I realize that the level of care I need is going up, but the energy that I have to meet that demand for myself is going down. So it's like at what point do you find that balance and where do you go to really be able to cry for help and say like, hey, I need a life preserver. Things are getting a little tough over here.
And that's one of the largest problems with the way that our medical system is currently designed. I highly recommend, if people have access to it, to seek out the help of a mental health clinician. They can be difficult to find, but anybody really can kind of help you with adjustment stuff. A lot of times you're constantly adjusting and you're constantly in the grief process when you have chronic illness, gastroparesis. It is a constant thing. And so having that burnout and that getting to that point, it's trying to stop yourself before you get to that point, because you really have to take care of yourself first and you have to make yourself a priority. And I understand that within our current society, being able to produce things, whether it's clean the house, make money, go to a job, do the laundry, that those sort of things are more valued than our own individual, like mental and physical health. Really untraining yourself from that and taking a step back and really focusing on yourself is that first step to then be able to schedule that phone call in your calendar. Now, I live and die by my calendar. I live and die by my to-do list. That's just the type of person that I am. Are there times where stuff comes up on the to-do list in the day and I don't do it? Yes. Lots of times I will push it off to the next day. But when it comes to scheduling physician's appointments, I will try to do that. And I'll try and do it at a point in the day where I feel more clear-headed, where I can do that, whether that, again, is in the morning or the afternoon. But you have to put yourself first, and you have to understand that that's the only way that you're going to get better, or not better, but that you're going to be able to continue to live your life is if you put yourself first.
Which, in that vein, I always used to really laugh at my mom and think that she was just nagging at me every single time she would say it. We'd be on the way home from Johns Hopkins. She'd be like, you need to call them and make that appointment right now while we're driving, while we have this 2 hours, while we're sitting here, because you know that we're going to get home and you're going to forget. You're not going to feel like it. You're going to feel tired. You've been traveling all day. Do it now while it's fresh in your head. And it would annoy the crap out of me. Now, at this phase in my life, I am at the point where I know in my heart, if I do not make that phone call immediately, it's going to get pushed off. So hear my mother's voice and definitely know to make that call immediately. Trust me, you will thank yourself. Do not be like me. You can make that phone call now. I am encouraging you. If you're seeing this video, this is your sign to call your doctors. Take care of yourself, please.
It's just such a difficult thing to do. I know right now, personally, I have been feeling very overwhelmed. I took on a ton of volunteer projects and stuff like that. And then you have all of the medical stuff that we're like constantly dealing with.
Why do we do it to ourselves?
You have to prioritize. I mean, you have to prioritize. And you have to prioritize not just, making the medical appointments, having to go do all of the medical stuff. You also have to prioritize fun things in your life, things that bring you joy, things that can counterbalance the issue of having to go to the doctor all the time, or having to contact them, or having to contact your insurance company and then feel super frustrated. You have to counterbalance it with joy. Otherwise, what is the point? What is the point if you're not
100%
enjoying your life or trying to?
Now, speaking of things that are somewhat maybe not as enjoyable, how do we deal with the more unpleasant surprises, like surprise costs, especially when it comes to the ER and hospitalizations?
That's where knowing your medical plan ahead of time is really important. That's why reading your evidence of coverage booklet, not just the statement of benefits that they give you if you're choosing on the exchange or if you're choosing from an insurer, but really intimately knowing the plan and what's covered and what's not is critical. It's like that's the critical first step. Secondarily, if you already know that you are going to be using probably the majority of the medical stuff all year long, then it might be better for you to choose a medical plan where you do pay a little bit more per month, but your costs are slightly lower. Personally, I know every single year that the medical plan that we choose, I'm going to max out on everything by about July. So all of my medical costs are front loaded at the beginning of the year. I know that it's going to be tighter. I know that I'm not going to be able to spend a lot of money on gifts. I know that we're not going to be randomly buying, large ticket items the first half of the year because I'm paying for nearly all of the medical stuff. My out of pocket maximum, I end up reaching it by about July. So being able to budget in that way is kind of critical. If you know that you're going to hit your out of pocket maximum, that's a great way to budget. If you are unfortunately in a high deductible plan and you run into, say, a hospital, an emergency room visit, and then a hospital stay after the fact because of your gastroparesis, it's really critical that you look at the hospital that you're going to see whether or not they have charity care. $4 is a fantastic nonprofit organization that helps you apply for charity care. A lot more people are covered underneath charity care than I think that they are.
What's the limitation,
I think it's 100.
monetarily?
I think it depends on the state, the organization, but I think in general for charity care, if you make 128% of the federal poverty level, you could qualify for charity care. So it's important to look at those things. Even if you have medical coverage, it's important to try to negotiate with a hospital for a lower rate. Now, this does not apply if you need a colonoscopy or another MRI or the multiple doctor's visits that you have to see. It's really unfortunate that we have to think about how much things cost when we're going to the doctor, but you can contact your insurance carrier if you are in more of a higher deductible plan. Shop around, see if there are any providers that have a little bit lower rates. It's really knowing your medical plan. One of the best ways to kind of get to know more about your medical plan is first you have to ask for the evidence of coverage booklet. You can then copy that entire booklet and paste it into something like ChatGPT. Tell it that it is a very knowledgeable health insurance broker, and then start asking it questions. What is my copay going to be with this? What are the limitations of the plan? What are the exclusions of the plan? Now, this is also separate from the prescription drug plan, which is called the formulary. The formulary can change up to 4 times a year. So even if the medication like Motegrity, I'm just going to use a brand name that a lot of us know. If Motegrity is on the formulary at the beginning of the year, it doesn't mean it's going to be on the formulary the entire year. And that can be problematic. Also, a lot of states are starting to put through laws in regards to prior authorizations and stuff like that. So it's really going to depend on the state that you live in as well as to how to reduce your cost. So there's a lot of different ways to do things. Again, reach out to people on groups like Harnessing Healthcare, on patient advocacy on Reddit, and ask those questions before starting to pay your bills. Never pay the first bill. There is a book that is named Never Pay the First Bill, because sometimes they're wrong. Sometimes you can negotiate even with insurance to pay a little bit less. So it's really difficult to budget though. Being sick is very, very expensive.
Yeah, Good Bill is another one that I've been hearing a lot about. I feel like anything that is exploiting AI in a way that helps us, I think it's always a better option. But I'm curious, have you found that there have been any specific strategies that have been helpful whenever you are speaking to the insurance companies or looking into really what the best plan is going to be for you?
For me, I know that the best plan is going to be the one that is the highest plan, the platinum plan, because yes, we're going to pay an exorbitant amount of money every single month for that medical plan, but our out-of-pocket costs are going to be slightly lower than they would be normally. Now, I want to very much so make it clear that I come from an extreme point of privilege. I have a husband who works. I have a husband who makes a good income. And therefore, I do not have to worry necessarily about these things. The things I do have to worry about, which I think all patients at this point have to worry about, is insurance company denials. And so in terms of like insurance company denying you access to your medication, denying you access to a procedure that you need, or say an MRI that you need, contacting the insurance company, contacting your physician's office, making sure that you know the reason why, which I can tell you a lot of times they're going to say it's not medically necessary. Or in terms of medication, they're going to say, you need to try this medication first. Contact your physician. Tell your physician it was denied. They will get a letter too that it was denied, and ask them if they can do a peer-to-peer review or to file an appeal with your insurance company. Sometimes that will get it overturned. A lot of time it will not, which means do not stop is kind of where this is going. Every single state has a department that oversees insurance. Most states, it's called the Department of Insurance. In the state of California, 96% of the plans are overseen by the Department of Managed Healthcare. We're the only state that has an independent entity that oversees our medical plans. File an appeal, file for an independent medical review. If it is critical, if you are in that phase where it is life or death with your insurance company, with the appeal, ask for it to be expedited. Let's be honest. When I contact the insurance company, I know much more than the person on the other end of the line. And most of the time, I'm educating them as to what their process is supposed to be. So if you're constantly having to educate your insurance provider, just go over their heads, do their little rigmarole, file your grievance with them, and then set your timer for 30 days, or if it's expedited, 72 hours, and then file with your Department of Insurance. Because most of the time they're going to deny it. You can try to get your physician to do like a peer-to-peer. Sometimes that will work for some medications, but a lot of times it won't. And so you will have to file for independent medical review. And it sucks as a patient that that is the only recourse that we have.
I think one of the craziest things I heard recently about insurance denials was that one of my friends had found out when she called her insurance that she had tried to appeal a decision 3 times and was denied. Found out it was never seen by human eyes.
That's not surprising. There's a bill here in California, I don't know if I think it went through, that AI cannot make those determinations at all. And I know that a lot of other states are starting to do that as well. One of the denials that I got recently was from a pharmacist about a medication telling me that it wasn't medically necessary. How can a pharmacist tell me that the medication is not medically necessary when that is the FDA approved thing that you use the medication for?
I've had that happen, and it's the most frustrating thing in the world, because then they'll cite that it's like indicated for something that it's not even indicated for, and you're like, what booklet are you reading from? It was when I was dealing with my Otezla, of all things, and they were trying to tell me that it was indicated for post-transplant. And I was like, why? And they're like, we can't give this to you unless you've just had a transplant. And I'm like, what? Like, this makes absolutely no sense. And then having to call the doctor and be like, hey, look, you need to call them and explain what this is for, because we actually have to fight to get this now. And I have no idea what to tell them at this point. Especially if, God forbid, you're like a new patient, you're dealing with a brand new medication, you know nothing about this. Because at this point, I still didn't know a lot about my medication. So I'm just like rigorously like screening through everything I can find, trying to see if this is even remotely true. And yeah, it's just very, very frustrating once you realize after all of this time that you've been at least a little bit misled.
Very much so. And I know that, it can be so incredibly frustrating, not just because a lot of people only find out about all of this stuff when they are actually like really sick, but you don't really feel like anybody is in your corner because you're constantly arguing with people alone. You're arguing with people on the phone. You're sending letters. You're constantly trying to prove that you're sick enough for them to actually treat you with the proper medication that your physician wants you to have, which can be really frustrating. Just remember, always try to be nice to the people that are on the other end of the phone, because they don't know. They're just in the system themselves. These are issues that are systemic and that are coming coming from the top. They're people that we're never going to be able to talk to that are making all of these decisions. So just be nice when you're talking to people. And, a lot of times they understand they're going through very similar things with your same insurance company because that's probably who they have insurance through.
It's actually really good advice because I have found that in the times when I was dealing with a denial or just any stupid, silly thing that came through insurance, and anytime I called and led with the understanding where I'm like, look, I realize this has nothing to do with you. This is just your goofy company's goofy policy, and I desperately need you to help me spell this out and figure out what the heck to do to ungoof this. And I found that 9 times out of 10, those people were way more willing to stay on the phone with me for up to sometimes 2 to 3 hours, just making sure that I had everything I needed just because I was kind in that moment.
Yeah, and they will tend to help you more. They'll transfer you, maybe they'll find somebody else within the company that can maybe answer you. And you can always just say, instead of, really sounding like you're angry, I'm incredibly frustrated and I don't know what to do.
What kind of tips would you have for someone who's very, very new to dealing with this kind of red tape? Someone who maybe they're going to have that initial phone call, they get that first bit of bad news, that first denial, and they're like, well, I can't fight this. What do I do now? I'm too sick. I don't have time.
You can sometimes reach out to your physician's office, and sometimes them doing the appeal will work if you are too sick. If you are too sick, you can have AI write your appeal letters. And sometimes they don't even really have to be that long, depending upon the type of appeal. To the insurance company, most of the time I write like a paragraph. I actually, during the conference that happened in March, I gave a presentation there that had a template for that. There are tons of templates online. It's for medical necessity because most of the time they say that things are not medically necessary because it's the easiest thing for them to do. Secondarily, when you are talking to people on the phone, and what I did was I have a designated folder that is conversations that I am having in relation to my health. I date it. I write down who I'm calling. So if I'm calling my insurance, I say insurance carrier. I wait for the person to tell me their name. I write down their name, representative so-and-so. I called at this particular time. And then at the end of those phone calls, I always ask for a reference number. There is only one insurance carrier that I know of. There may be more. There's only one that I know of that doesn't use reference numbers for anything, which is really frustrating. So that's where that date is really important to keep track of, that date and time. And if you can, get the person's name, and you kind of have to inch it through there. You can lean on your physician for some stuff and see if their office will be willing to kind of help you fight it. You can, again, reach out to people, different communities and stuff like that online, and see if maybe people can help you there. Unfortunately, I have to say, you have to push through. And I really don't want to tell that to patients because we shouldn't have to be doing this in order to get medical care. But you have to push through. You have to lean on your family members to help you write some of these things if you can't do it yourself. It's really unfortunate, but it unfortunately is the truth.
I think for me, the thing I have always been worried about in the past, but I've been pleasantly surprised every single time, is that every time I would trouble my boyfriend and his family, I would always be worried anytime I would have to make follow-up appointments. Like, I would be excited that they'd be able to take me to that one initial appointment, but then all the follow-up, I'd be so worried about asking for more things from them, asking, take me to the pharmacy, and all these other things that go with that initial appointment. And I've always found in the end that they've always been more than happy to help, and that it's never been the burden that I thought that it was. So I think the bit of advice that I would give to people who are afraid of being vulnerable and of asking for help and asking of too much, don't be afraid of that. Have more faith in your friends, have more faith in your family. At least give people the chance to show you wrong. Give people the chance to help. Give people the opportunity to be there. Because 9 times out of 10, they really do want to be.
Well, and COVID kind of showed us that connection with our community is really important. And that can be as simple as asking someone to take you to the doctor. Okay, maybe you don't see that person often. Well, at least you can see them while you're going to the doctor, and you can have a chit chat. And then you can have a chit chat while you're waiting an hour for your doctor because they're running behind. And then you have a chit chat in the car on the way home.
It's
I think,
social.
yeah, I think that people, we've all become, particularly in the United States, so incredibly independent that it has completely screwed up our way of thinking about community and how we should help one another. Just because you are asking for help in a particular way that you may feel is more of a burden on somebody else because it's something difficult that maybe you can't do yourself, it doesn't mean that you are not giving back to that person in another way, in a way that they need. So keeping that in mind, really the burden aspect of illness is very difficult. And they could probably do a whole hour on the burden of illness in general.
Right.
But really keeping in mind that most people want to help other people. It is innately who we are as human beings. Being able to depend on other people, being able to ask them for favors, and then be able to do very little things for them. Maybe you can't do it right now. Maybe your gastroparesis is too bad. That doesn't mean that your gastroparesis is going to be this bad forever. And so being able to really invest in those relationships, I think, is really helpful when you are going through stuff like this.
We tend to gaslight ourselves into thinking that the moment that we share something this deep, this vulnerable, we're going to scare people. Like, that's going to be too much for them. We've officially hit a threshold that is somehow uncomfortable. But I've always found that in the moments that I did decide to level with someone and be like, hey, like, I'm gonna let you in on this part of my life now that I've been really scared of bringing up, I found that people have genuinely taken time to listen and actually feel really, really respected in that moment because you're letting them into a part of your life that took you a lot of time and consideration to say, okay, I finally feel safe enough. I feel like we're at a level where you can handle this and you're not going to freak out and everything's going to be normal and you're not going to treat me any differently. So I feel like you're really kind of establishing that connection, that friendship, that whole relationship right there. So maybe it's the reframe of not seeing it so much as I'm going to burden this person and maybe seeing it as we're going to deepen this connection. This is going to be something special. This can be special if I let it be.
100%. Completely agree.
No, and I think honestly that is the perfect way to close it up, unless you have any other advice that you would love to give to patients, old and new. I know we've all been through so much dealing with this very shitty disease, as Sam would say. I mean, I have to channel her when she's not here.
I mean, I would say reach out to community for other people that have gastroparesis. I have found a lot of support and connection through peer-to-peer support groups. G-PACT has 2 fantastic ones now. Even the Facebook group that G-PACT has, really being able to immerse yourself in community with people that understand, where you can just like yell into the ether, like, all this shit happened and I don't like it. And we can be like, yeah, we totally, yep, we understand. And you could just vomit all of that stuff out to us so that you can at least get it somewhere and you're not just holding it inside, because we're all going through that journey on different paths, but we're all headed, the same direction. So being able to really connect with patients, I think, with other patients, is really important.
I couldn't agree more. I think we all need to very much channel the spiteful survival energy that I think is so present, especially in G-PACT. And I think the biggest hope that we have in what we're creating here, especially here on this show, is the ability for people to see themselves represented, to be able to talk about topics that literally I don't think anyone else is comfortable broaching. And I think that's such a beautiful thing for us to be able to take on and for us to be able to challenge. And it has been absolutely wonderful having you on and getting to really explore the spiteful side of healthcare. And I know that next week, Samantha is going to be back on with her better half. I will probably be taking a small break, but you will see me again very soon in the near future. So with that, my name is Levi Peterson.
I'm Victoria Killian.
And keep on surviving spitefully.